So hello everybody. I've been registered and qualified as a physiotherapist since 2001. I'm looking forward to giving you a little bit of an insight to what is physiotherapy. When the slides come up shortly, there's a nice picture of somebody leaping across the page and you can see all their muscles. And it says, is this person in pain because of the way they're moving, or are they or are they in pain because of I can't remember the just now. It's very powerful anyway. There's a lot of muscles, and I was going to start by telling you that there are approximately 600 muscles in the human body. Physiotherapists will look at muscles, joints, ligaments, tendons. Some physiotherapists work with people with problems with their nerves, with their respiratory. It's very varied role. There's a nice little Wikipedia statement about what a physiotherapist is. So this is the lovely picture I've got. Are you moving poorly because you are in pain, or are you in pain because you're moving poorly? And that often happens with physiotherapy. People might develop complications because of the way they posture, or because of their sporting, the way they've got a faulty sporting technique. So it's your job as a physiotherapist to work out what comes first, chicken and egg. Right, on to the next page. So what is physiotherapy? It's one of the allied health professions, also known as physical therapy. I think that's more of an American term. It's provided by physiotherapists who promote, let's see if I can move this around again, maintain or restore health through the physical examination, diagnosis, prognosis, so working out what's wrong, patient education, physical intervention, rehabilitation in the form of exercises and advice how to manage a condition, and disease prevention and health promotion. So it's a very, very varied role. You might provide all of those skills in a session with a patient, or you might focus on one or two things like health promotion or exercises, or doing a thorough assessment and advising somebody about their diagnosis and what to expect with treatment. On to the next slide. So daily routine. So most roles are Monday to Friday, 9 to 5. So they're quite a sociable role. You'll turn up to a doctor's surgery or a hospital outpatient clinic, or you'll turn up and work on a ward, depending on what your speciality is. And you'll have a caseload of patients to see. And throughout the day, you will visit the patients, take a new assessment, look at treatment, and make a plan for when you'll see them next. So it's quite a structured role, and during that time you'll be writing up your notes, chatting with other health professions, other physios, OTs maybe. They call them the multidisciplinary team, so it could be a nurse, a doctor, which is always great fun, interacting with other disciplines. Physiotherapists do respiratory physio, and can be called upon to go up onto intensive care and high dependency units in hospitals and help people who've got very poorly chests, and that could be helping them cough, helping them with positioning, and helping to remove horrible sticky secretions off their chest. So that is a form of physio that you will experience as a junior physiotherapist. Everybody will learn that area. There are also some roles where you'll work extended hours, and that could be around helping somebody who's in hospital who needs to go home one evening rather than wait until the next day or wait until after the weekend. So it's all about facilitating effective patient care and not having any bottlenecks in the NHS. Next slide. Oops. So this is just a little bit of a snapshot of all the different physio roles. You can see there's respiratory, orthopedics, that's bone, learning disabilities, surgical, mental health, elderly rehabilitation, neurology. And there's also some very specialised roles, such as working with paediatrics children, amputee rehab, palliative care, people who are sadly on the end stage of their treatment for maybe cancer or something, and women's health. So, you know, you might not do all of these things, but as a junior physiotherapist, you will probably do maybe 4 or 5 of the core rotations and have experience of these. The next slide. So to be a physiotherapist, you need to have 2 to 3 A levels, and you must have a biological science, and you must have 5 GCSEs graded A to C. It's usually a 3-year degree course, and sometimes if you end up doing another degree and want to transfer into physiotherapy, if you're doing a relevant degree, for example, sports therapy or something like that, then it's a 2-year accelerated course. And once you qualify, you will get a professional registration number and you become a member of the Health and Care Professions Council, HCPC. So you cannot work without having this registration. Next slide. So what skills do you need to be a physiotherapist? Well, you need to have good listening skills, because you're having to listen to people's troubles and sometimes trying to extract information from that to work out what's going on. You need to be caring. You need to be physically fit, because when you're doing assessments, if you're an outpatient, you could be doing a straight leg raise lift of somebody's leg. And so you must have a good awareness of, good manual handling techniques as well. Able to motivate people who don't want to do exercises, but exercises will be the best way to get maybe a recovery from a knee operation or a back injury, and able to work on your own or in a team. Next slide. So this slide is just saying what's the requirements for physio. So you have to have good manual handling skills. You're using your hands a lot. So we'll do an assessment we'll listen and we'll look, and then we'll use our hands to feel. So having good handling skills to sort of feel muscle and try and feel what's going on in the body. Organisation skills, organising your patient caseload, making time to write notes, planning. Communication skills are really important. If you're interviewed for a degree position in a university, then demonstrating that you've got really good people skills is really important. Able to explain treatments to patients. So it's important to be able to step back from the medical terminology and to break it down and to be an effective communicator and to help them take away the advice and get the best from it. And potentially business skills. So if you go into private practice, that's something that might be useful in the future. Next slide. So the opportunities, so you get to work in a multidisciplinary setting. You can work in fracture clinics, you can work on wards, you can work in a school with children with learning difficulties or paediatric rehab. It's unlimited, really. You can work for the National Health Service, or you can work for a private practice if you want to go straight into outpatients. I worked in New Zealand for a year. You can work in Australia, Canada, lots of countries recognise our degree. The only thing to be aware of is that you'll have to do possibly a small exam to show that you're competent, and you'll have to get all your documents certified so you can work abroad. But there's great opportunities for abroad working. You can keep on doing additional qualifications and become an extended scope practitioner, where you can then refer for important investigations like MRI scans, where you can give injections for pain or prescribe medications. You can go into lecturing or research roles. And you can also go and work for private companies, get involved with case management companies where they help people who have had life-changing accidents and be an overall clinical coordinator for their care. So there's so much that you can do. You don't have to just be that physiotherapist in that outpatient role. It's unlimited. Next slide. So the advantages and the disadvantages, or the challenges. There's diverse work roles and working environments. I think that's an advantage. You'll gain great skills, but sometimes it can be challenging too. You have to constantly sort of grow your knowledge and be able to adapt. It's got a very structured career progression. So you start as a junior and you build your way up to different levels, which have different pay scales. There's a good NHS pension. And just being able to help people make a difference is a wonderful thing. It's a very competitive role. Getting into physiotherapy can be competitive. Caring for people in pain is not easy. And the working patterns can be demanding sometimes, depending on what role you're in. So they could be the challenges. Next slide.